Is it more virulent? Is it more contagious?
Is it more contagious? We look at the contagiousness of a disease by seeing how many cases can one infected person cause.
Yes.
Our belief now is, and this is updated information, is that one case can cause up to 4.9 other cases.
Okay.
Our earlier estimations in the middle of last month was that one case can cause up to about 2.5, 3 cases.
Yes.
Yep.
So looking more closely at the data emerging from China, there's a revision of this. We are now thinking that one case could result in up to 4.9 cases. Yeah. So the infectivity is slightly higher than SARS.
Yeah. I mean, applying as well the gestation period for a lot of people, as has been reported, it's possible for you to be carrying this and still be asymptomatic. There are gestation periods, as we know that you're factoring in. Now that we're looking at this deceleration and hopefully it's sustainable, is there a particular window of time where, if the trends hold, we can safely say it looks like we've crossed into a certain level of more confidence?
Yeah, so I believe you're talking about the incubation period. The incubation period is from when a pathogen gets into a person and that person becomes symptomatic. In this case, our current estimates based on currently available data is that that's about 12.5 days. With previous coronavirus infections, we estimated it to be about 14 days. So we still say for this disease also it's 14 days.
Okay.
So what we are saying is, if you have had contact with somebody, if you've been exposed, likely you need to follow a quarantine period of 14 days. And if you're not showing signs and symptoms at the end of that period, it would be reasonable to assume that you are not infected.
Okay, but on a larger societal level and on the big numbers that we're trying to monitor, does that therefore then say that, you know, if over the next 2 weeks this trend holds of a deceleration, if not a decline in the numbers that we're watching, that we're more or less approaching a new chapter that where it looks like it's on the brighter side of the news?
That would be correct to say, yeah.
Okay.